Braunfels police have arrested 8 people and seized thousands of fentanyl-laced pills.
An 18-year-old is facing a murder charge in connection to a fentanyl-related death.
We're learning about a record-setting fentanyl bust during a traffic stop.
He was arrested on Tuesday about
in U.S. history.
I am Liz Petty, Public Health Education and Outreach Manager for the North Texas Poison Center at Parkland Health. We started receiving several requests from schools, partners, and organizations looking for good evidence-based education around fentanyl. And so with that information at hand, we created a program titled Fake and Fatal, where we educate both students and adults about opioids, how they work in the body, and also provide information specifically on fentanyl and how to use naloxone in case of an opioid poisoning or overdose. One of the resources now that we provide in Dallas County is Addiction Hotline, where people can call and get plugged into a resource to help them if they do have a problem with any drug. 4 out of 10 pills contain fentanyl, and that's pretty scary.
North Texas Poison Center, my name is Suliat. I'm an RN. How can I help you?
The Poison Center is a great asset, especially to EMS, right? If there is a medical emergency, somebody has lost consciousness, can't breathe due to opioid poisoning or overdose. The great thing about working in collaboration with other providers is they're usually placing a call to the Poison Center in between that transfer to the hospital, where we're gathering information and prepping the hospital ahead of time, letting them know what to expect when the patient arrives.
I'm wonderful. How are you doing?
I help people get off drugs and alcohol and stay off drugs and alcohol. Well, I am in recovery myself, and my passion is recovery and helping people. It saves lives, honestly. The fentanyl epidemic is real, and it's deadly, and harm reduction is very powerful. And some of these people are patients or doesn't have anyone else to advocate for them. So I pride myself in being available at all times to all patients. I love it when we get a walk-in, a guy from jail. First thing I do, go out there and let them at ease. We're going to help you as best we possibly could. I'm going to take care of you as long as you allow me to do that. I am here for you no matter what, because my recovery begins when I get off.
I believe that we are a outpatient program that's holistic. We meet the patients where they're at. We provide them with individuals who are passionate about providing services to the patients. We have peer recovery navigators, individuals who have lived experience, who can talk to the patients and just put the patients at ease once they come into the building. We have social workers who are willing to provide resources and just walk the patients along with the peer recovery navigators to their next step. We have passionate providers who are here daily, who want to see the patients and just provide them with the best care possible. When there wasn't this program, patients experienced barriers, and there were a lot of barriers to them connecting to programs in the community. And one of the things that occurs with frustration, stress, and everything like that, our patients will return to old behaviors. The likelihood of using drugs would increase. One of the issues with that is when the patient is clean for, without drugs for some time, and if they go back to using the same amount that they last used, there's a higher probability for overdose. What I want the community to understand is that this is a public health crisis, and we have to respond in a humane way. These medications are life-saving. It gives our patients a chance to win this battle. It gives our patients the ability to live one more day.
When the governor called for awareness about the fentanyl crisis, Parkland stepped up, and we did that in a way of calling to action with education, prevention, stabilization of our patients, and really the partnerships of our community organizations. We alone can't do the work by ourselves, and we recognize that we work as a community. The crisis is something that we take very seriously, and we stepped up in a way that was collaborative with the strategy.
Parkland is in the fight, and we're not giving up.